and they all have similar mechanisms of action, but due to the half-life and the way by which the body metabolizes and releases the medication, they do have different side effect profiles.
I get horrendous back spasms from Cialis, but I don't from Viagra. Any way to mitigate this?
Yeah, it's funny because these are phosphodiesterase 5 inhibitors, and they all have similar mechanisms of action, but due to the half-life and the way by which the body metabolizes and releases the medication, they do have different side effect profiles. So Tadalafil, which is a generic of Cialis, is known to cause some leg cramps and lower back cramps. If, in fact, you get those side effects, it's usually dose dependent. My first recommendation would be to lower your dose. We don't know anything about his dose and frequency, but guys that use it daily, I would say cut your dose in half or move it to every other day. It's a long half-life. That would be okay too. See if that subsides. If it does, stay there. If that doesn't subside, try discontinuing for 2 weeks and seeing if it subsides then, and then try to restart at a lower dose. When it comes to Viagra, it's a different side effect profile. That tends to give the sinus pressure headaches. It pulls the blood right in the center between the eyes, and it gives you like this uneasy headache. So that is essentially a faster acting medication. Usually kicks in within about an hour, has about a 3 to 4 hour, peak effect, and then it starts to subside. So both have the same mechanism of action, PDE5 inhibitors. Both have slightly different side effect profiles. You got to play with the dosing. Some guys are more sensitive to it than others. I've seen patients that use Viagra or Sildenafil can't tolerate any dose. Seen the same with Tadalafil or Cialis, and the same goes for Levitra or Vardenafil, which is a generic form. But there are three popular. There are more, but there are three that I just mentioned that are very popular. You could play with the dosing and frequencies until you find something that works for you. If you're using it for erectile dysfunction, you should have a proper and full assessment, sexual dysfunction assessment, which is about 50% of what we do in our office every day. And there may be other options for you. If you're using it for other reasons, then we'd have to know the specific reason and try to guide you a little bit better.
Check out my TRT workout split or the ebook The Ultimate Guide to TRT Cream. Links to the merchandise shop in the description.